Healthcare workers across Michigan sounding the alarm as the state sees new coronavirus cases and hospitalizations soar. One emergency room doctor's plea is going viral on social media. Listen to this.
When you get this other strain, it's more transmissible. You're going to spread it to more people, and we think it might be more deadly. We got to do better, folks. The light is there at the end of the tunnel, but we're just not going to get there unless we do all of it.
Joining us now, Dr. Nick Gilpin. He's the medical director of infection prevention for Beaumont Health. ICU capacity at his network of 8 Detroit area hospitals is 90% this morning, or even higher. Dr. Gilpin, thanks so much for being with us. I've heard you say, we can add beds, we can find space, but what we can't do is find the people, the medical professionals, the doctors, the healthcare workers we need to address this. How much of a strain is this putting on you?
Well, that's right. This has been the limiting factor for us really since the beginning of this pandemic. Early on, as you recall, we had challenges with space, and we had challenges with testing and PPE, and those things are much better today, thankfully. But the one area where we still struggle mightily is with staff. And as you just said, I have said that before, that we can create beds, we can manufacture beds, and we can create field hospitals, but we simply can't find the staff to adequately staff those beds.
Look, we've vaccinated half the adult population in the United States, which is a great thing. Why can't we just vaccinate our way out of this problem in Michigan?
Well, first of all, I want to applaud the efforts to get vaccines in arms as quickly as possible. I think my state of Michigan has done a fantastic job of this. I think other states are doing a wonderful job of this as well. But the fact of the matter is, in Detroit right now, where I'm practicing, this is what substantial community transmission looks like. And even if we could vaccinate every remaining citizen tomorrow, there's a lead time that it takes for the vaccine to be effective, and that can be as long as 6 weeks, especially if you think about a 2-dose vaccine like the Pfizer or the Moderna vaccine. It could take 6 weeks to get the full effect of the vaccine. And frankly, that's too long by itself. So as an important mitigation strategy, of course, we want to get vaccines in arms, but in a period of substantial transmission, such as we're living in right now, people have to do other things to help contain this as well. And that means all the things that I've spoken about, that Dr. Fauci's spoken about wearing masks and social distancing and staying home and preferring outdoor activities over indoor activities. That, coupled with the vaccine strategy, is really what's going to get us through this.
But Dr. Gilpin, what do you say to those people who will say to you, look, Doc, we've done that. We did the shutdowns. We did the stay-at-home orders. We did the restrictions. We can't go back to that again. We're past that.
Yeah, listen, I respect it. Everybody's tired. We all have COVID fatigue. I've got COVID fatigue. My staff here at the hospitals have COVID fatigue, and people do too. And I think we're seeing that happen in real time in our communities. It's getting warm outside. People are getting spring fever. They want to travel. But in the face of that, we've got this significant risk still in our backyard. And the risk really is, if we allow this virus to continue to transmit itself and make more copies of itself, there's a substantial risk that it will continue to alter itself as well. And that is a tangible risk. We've already seen that play out with the B117 variant and some of the other more transmissible variants. So, I get it. We're all tired and we don't want to go back to a world of restrictions. We can self-impose those restrictions, and we can use what I call a common sense approach, sort of the so-called door number 3, where we can, wear our masks and really limit our capacities, our gatherings, our sporting event activities, our things that we know will propagate this virus. We can do it ourselves. And if we can do that, I think that's great.
Dr. Gilpin, we appreciate you being with us. We wish you the best of luck the coming days and weeks.
Thank you.
President Biden